let me explain kidney disease to you. Imagine that this sieve is one of your kidneys, and imagine that we have a mixture of water and mustard seeds. If I pour that mixture in here, the water will drain out and the mustard seeds will remain in the sieve. That is like a kidney that is functioning well. It lets out what it should let out and it keeps in what it should keep in. Now imagine that I clog up this sieve and I pour in that same mixture. The water will drain out slowly and may not even drain completely. That is like a kidney that is not functioning well. It is not letting out everything that it should let out. Now, the problem is that most people think that this is the only thing that is kidney disease, and unfortunately, it is not. And I will explain that further. Now, imagine that I poke holes in this sieve and I pour in that same mixture. The water will drain just fine. However, if you look in the water that has drained out, you will find that some mustard seeds were actually let out. That's like a kidney that is like a kidney that is spilling blood or spilling protein. And that is not good. That's kidney disease. Now, imagine that for some reason, either through trauma or the way it was manufactured, this sieve doesn't have a handle. The function is still good. It is letting out water and keeping in mustard seeds. But if this is a kidney and I do an ultrasound or a CAT scan or an MRI, I will find that there is something not normal with the kidney. You're supposed to have two sieves, and let's say I do an ultrasound or a CAT scan, etc., and I find only one sieve. That is kidney disease. Now, one may ask, if the kidney function is good, so what if I'm spilling protein or any of these other abnormalities? Well, these are the things that puts one at risk for eventually developing low kidney function. Let's take the spilling of protein, for example. Let's say you have diabetes or you have high blood pressure that has not been so well controlled and you're starting to spill protein in your urine. And now, let's say you have high blood pressure that's also not controlled. That is like when you have holes poked in this sieve and you have your mixture in here and then you're putting more pressure in it. Eventually that hole will get bigger and bigger and you will eventually destroy the sieving apparatus, and eventually the function of the sieve itself will be affected. So I'm saying all of this to say, if you have low kidney function, yes, you should take good care of your kidneys to prevent the kidney function from going lower and lower. But if you also have good kidney function, but have an abnormality in your blood test, in your urine test, or in your imaging test, you are at a risk of eventually developing low kidney function, because these are abnormalities that can be built upon to eventually cause kidney dysfunction. You should also learn of ways to take good care of your kidneys and take care of every other thing that could affect your kidneys and cause it to develop low kidney function. Now, this is not to say that the rest of you are safe. If everything is normal and you're not taking care of your kidneys, you will also develop kidney dysfunction. It's like this sieve is completely normal, but you're treating it like, it's indestructible. It will eventually get destroyed. I hope that has been illuminating. If there are any questions, please feel free to leave them in the comments. I'll be happy to answer or make more videos. Thank you for watching, and as always, take care of your kidneys.